Hello, I'm Dr. Dennis McKenna, and I'm joined today by Chris Couchet. Chris, great to have you here.
Thank you for having me, Dennis.
You've been here before. Everybody knows Chris. Been here for over 25 years, I think.
On my 30th.
30th. He's our Chief Information Officer and doing a great job. So welcome, and we'll talk about Care One in a couple of moments.
Great, thank you.
All right, good. Today is Thursday, January 5th, giving you the update from Albany Med. So we'll begin by saying Happy New Year. I hope you had a great New Year.
It was very good.
I did not get the peppermint pig this year.
No peppermint pig for me.
You know what that is? You crack it.
it.
Yeah, I forgot about that.
Christmas tree pickle, though. German custom.
I did get a couple emails from people who said that they did watch Prep and Landing based on my recommendation. So that makes me quite happy. So a Happy New Year to our entire workforce out there. January 1st also is the first day that Dorothy Urschel took the lead role down at Columbia Memorial Health as their CEO, and we congratulate Dorothy running that campus, very part of the Albany Med Health System, joining Paul Sameka, Jill Van Kuren, and Sam DeChico, who run the other campuses along with the VNA. So congratulations to Dorothy and welcome aboard. All right, Chris, one thing that we always do every year in January are town halls. This is an opportunity really to kind of look back at all the accomplishments that we could record in 2022, and then also lay out the vision for the coming year, 2023. I'll tell you, it's really hard work to put together a presentation that's limited to an hour because there is so much to talk about.
So much, yeah.
We talk about our tripartite mission: clinical care, education, research. We talk about being a health system with 4 hospitals, plus a children's hospital and a college, visiting nurses, so much system work. But we put it together, and I'll be out. There are 7 different times that we're going to do this. Everyone should have received an email, or you can check on the intranet. We offer most of them on the Albany Medical Center campus, but I'll also be at South Clinical Campus, and I'll also be down at 1275. We will offer them during the day, morning, evening, weekend. We have lots of different options. There's not going to be a virtual option,
right.
But if someone can't make any of those, we will be sure to record at least one.
That's right.
So they can watch it when it's done. And we really encourage people to come out, not just to listen, because I think there's a lot to hear and be proud of, but to ask questions as well.
It's a good way to celebrate what we've done as well.
Yeah.
So.
And I know many of the executives like yourself will often come because people might ask me a question that I can't answer. And it's always helpful to have other members of the executive team there if there's a specific question, for example, about our IT. So anyway, a great opportunity. Please look for that. And we'll be looking forward to doing those in the next week or two. Next week is Schwartz Rounds. I always like to put a plug in for Schwartz Rounds because I think they're so important. And I think it's something that really benefits our entire workforce. That's next January 11th from 1 to 2. I think it's typically in Hike Auditorium, and that does have a virtual option. This one's called My First Day on the Job. There's always a theme, right. And there's some presenters, usually 3, and then they open it up for reflection and comments from people either in person or virtual. My first day on this job was April 1st, 2020. April Fool's Day. We always joke about that. But then I also remember my very first day at the medical center as a medical student, right, back in 1992. Do you remember your first day on the job?
I do. I actually remember the day I came in for my physical. I got in a car accident on the way to work. So it was very memorable.
Yeah.
But September 28th of 93.
And you started here as
I started here as the clinical engineer. So all of the biomedical equipment is what I was responsible for. Yeah.
Graduated from RPI and came right here. So first day on the job. That should be a great Schwartz Rounds. I encourage you to attend those if you can.
And I find those to be really helpful for those people who aren't necessarily clinical in their job role. It's a really great insight to what happens around the medical center. Yeah,
it really is. I've attended several, and they're really very good. Another thing I attend regularly is blood drives. January 26th from 7A to 3P in F309. And I just learned this. It's also open to the public. So if you are watching this and you want to register, you can also come in on campus and donate blood here. Although obviously it's very convenient for our workforce. I've told this story a couple times. When I give blood, if you do the rapid pass, you can find out what they call your blood's journey.
Yeah.
And I think my blood recently has been going out to Syracuse, where my daughter goes to school, but her blood came here. Right?
Oh,
So
wow.
it's kind of cool. So anyway, blood drive, we encourage our workforce to give that. Have you ever used any of our emerging cares?
I have.
Yeah, they're great.
Many times.
Yeah, they're great. And we have 11 of them, and there was 2 of them that were shut down temporarily over the last couple months. And I'm very pleased to say they're open again. So thank you, first of all, to our emerging care staff. Thank you to our emergency department and our faculty practice for getting those up and running again. So the 2 sites that had been closed were Glenville and Guilderland. So they are now both up and running. So we are opened again. And one of the changes that we will see is that our emergent cares will still be available to the public 7 days a week, but half of them will be open on Saturday and half of them will be open on Sunday. So there will always be an emergent care either in your neighborhood or close by that you can access 7 days a week, but we'll split which ones will be open on the weekend. And that allows us to be sure that we can get those other 2 open up again, which is wonderful. So our emergent care is fantastic. On average, people are in and out in under an hour,
Great.
well under an hour. And I've been there a couple times as well. They do great things.
Shout out to Wolf Road.
You like the Wolf Road one? Yeah.
Right around the corner, yeah.
Very good, very good. All right, Chris, and let's get to the main reason you're here, Care One. Care One we've talked about many times. Care One is kind of the umbrella term for our project that is looking at bringing on board a new ERP, bringing on a new electronic medical record, as well as infrastructure and cybersecurity built around that for the entire health system.
Absolutely.
So to kind of put this in perspective, right now, depending on where you access care in our health system, Columbia Memorial Health, Albany Med, Saratoga, or Glens Falls, if you are in a practice location, if you are in an inpatient location, if you're in one of the urgent care locations, 11 different medical records.
11 different medical
Right?
records.
So we're going to have one. A lot of work. Your team is leading that along with many others. So let's break those down. How are we doing on the cybersecurity front?
Cybersecurity is going great. We've got 60 individual projects, so 60 individual implementations of software, of hardware across 4 different hospital campuses and 120 plus different offsites. We've got about 45 of the 60 complete right now, which is great.
Amazing.
And it's an effort. All these efforts are really people across all 4 hospitals. So.
Yeah. So we know that there's a lot of interest in what we often refer to as bad actors who want to try to get in and breach PHI.
All the time.
All the time. And so your team is making sure that the medical information that sits inside those medical records is safe and is not going to be accessed unless it's intended to for healthcare delivery.
Yeah, and it's, the PHI is certainly one issue that we have with all of the medical information that we have, and we are the most valuable record in all the markets, right? We're worth the most. Yeah. So we get attacked every single day, constantly throughout the day. The numbers
attacked
are staggering.
but blocked.
Attacked but blocked.
Yeah. Because of the efforts.
Again, just whether it's tool sets, whether it's our people, finding things and watching trends and watching our tools and just a lot of activity.
All right, great. Let's talk about infrastructure. Which, when I think about that, I think about the monitors and the tablets we use and the servers. Am I right about that?
Yeah, that's part of it. We just completed an inventory across all 4 hospitals, 120 plus offsites, to look at what we actually have in each site and how they're used so that we can customize them specifically for our Epic rollout. So over 12,000 devices. Wow. We're doing an analysis right now to see what else we need. We've got budget for that, and we'll know, we'll be putting some orders in within the next month or so. But it goes beyond, infrastructure goes beyond that. We're also building a regional network.
Good.
So a resilient network that will have connectivity between all those sites, 4 hospitals, all of our sites, the VNA, and we're also building a resilient way of doing disaster recovery. So let's say something happens, we lose part of our data center, we lose power, whatever it may be. We have the ability through this project that we're doing to get what's called a co-location site. So we'll actually have a remote disaster recovery site that will allow us to continue operations.
Well, we run 24/7. We're the area's only trauma center. We're the area's only children's hospital. There are certain things that we just need to be able to do and never be down. So that sounds like a very important thing to make sure we're always up. Next thing, let's talk about ERP. Now, we know the ERP is in many ways more about HR, finance, supply chain, very comprehensive. We're going to the best available ERP out there, Workday, across the entire system, and we're going live this year.
Absolutely. Plan is July, beginning of July of this year. They are on target. The team is doing a wonderful job.
Amazing.
Kim Williams and is kind of orchestrating the
sure
dance. And along with others, but they are starting end-to-end testing beginning this month. And what that basically means is that they're, instead of looking at every individual function to see if that is built right, they're now looking at the entire application to see how these things work and make sure that every scenario that we use actually works the way it's designed.
So I was in a meeting with you yesterday. Remind me, how many different scenarios do we test?
It's thousands.
Yeah.
Thousands.
Thousands, yeah. So ERP this year, we look forward to that. And then lastly, kind of the medical record, Epic. I think we've talked about this many times. If you look across the United States, and when you look at top academic medical health systems, think of the Johns Hopkins of the world, think about the Cleveland Clinics of the world, they're all on Epic. This is obviously, I think, the best platform out there for an electronic medical record, not just for end users like myself, a physician working in the emergency department, but the experience for the patient portal, the way in which they can access their own medical information, the way in which information can be shared between doctors and others in the community. Going to be fantastic. Big project next year, right?
Next year, 2024, in probably the end of first quarter, beginning of the second quarter for the Albany campus, and then about 6 months after that, we'll go live with the Glens Falls campus, the Saratoga campus, and the Columbia campus.
So,
and we're also looking, again, the VNA also is part of this. They'll be a little staggered another year after that because they're on a totally different platform within Epic, but that'll be a great opportunity to standardize.
The neural network for our system, right, all the way across the board. Just yesterday, I was thinking, boy, it's only about a year from now, plus or minus, a little bit more, but we'll be lighting it up on this campus. So a lot of people doing tremendous work there. How many different work groups are there working on Epic?
There are over 50, over 50 individual work groups that Dr. Victor Becker is really coordinating and organizing. Those 50 represent all 4 campuses, our practice, very diverse, our college, very diverse in terms of what those groups are doing and who's on them. So,
all right, very good.
Never seen anything this large at Albany Med before.
Massive, massive, but going very well. So that's it. So I wanted to be sure we gave appropriate amount of time for us to get an update on those projects. I know we'll have you back, and when we do, we can get an update then. But thank you, Chris, to you and your team for everything you're all doing and keeping us on time, on budget for this really transformational project, the Care One project here for the Albany Med Health System.
Great opportunity.
Okay. Anything else before we go?
That's all I've got.
All right, very good. Happy New Year again. Thank you. We'll be back probably in 2 weeks, and we look forward to seeing you then. Thank you for everything you're doing now more than ever. We need you here working with us 24/7. Take care of yourself, take care of each other, and we'll see you in 2 weeks.